Hi, this is Dr. Mark Kontos, and I'm here at Eyetube's daily coverage in Amsterdam. And with me today is Dr. Frank Goes. And Dr. Goes is in private practice in Antwerp, Belgium. And he's here today to talk to us a little bit about the SMILE procedure. Dr. Goes, thanks for taking some time to visit with me today. And I'm real interested to hear what you have to say. You're an expert in this area, and this is something that you have a lot of experience with. Tell us a little bit about the procedure and kind of how things work for you in your practice.
Well, until recently there was only LASIK or PRK, and the PRK patients, we know that they were really stable on the long term, but they had pain and the recovery was quite slow. And then you had LASIK, the stability is sometimes a little bit of a concern. You want to avoid ectasia, but they don't have pain, and the next day they have an excellent vision. So the ideal hybrid between the two of them is Relex Smile. Yeah. The SMILE procedure is stable on the long term. You don't create a flap. You can't have wrinkles in the flap. It's better for the dryness of the eye. You don't have dry eyes because of the corneal nerve fiber layer. And the stability of the eye should be better in the long term. And contrary to the PRK procedure, the next day they have an excellent vision. So it seems that this is the ideal procedure. So what we wanted to know in the study that we did on the first 115 patients was, is it as accurate as femtolasic? How about the efficacy and the accuracy? And we did a study on 115 eyes. At this moment, the first 115 eyes, we didn't have any retreatments at all. The mean spherical equivalent before the surgery was minus 5.34 diopters, and the mean spherical equivalent afterwards is plus 0.24. So it's really an effective technique. We didn't have any loss of best corrected visual acuity more than one line, and after 3 months, 2% had a gain of more than 2 lines or more of best corrected visual acuity. So at this moment we can say it's not only better for the structure of the eye, for the corneal collagen fibers, for the stability, for the dryness of the eye, but it's at least as accurate as femtolasic, if you pick the right patient, of course.
Well, that's really interesting. Are there any particular patient candidates or anyone that you look at specifically for this type of surgery, or people who are not a good candidate for this surgery, or how do you look at that?
Yes, Relex Smile is not an ideal procedure for people who have low degrees of myopia. If you have degrees of myopia less than 3 diopters, the lenticule that you want to remove might be so thin that it can tear when you remove it. So everybody advises to start with higher degrees of myopia and astigmatism less than 2.5 diopters. But if you choose the ideal patient to start with is somebody with spherical myopia, minus 5.5, minus 6, with a wide-to-wide more than 12 millimeters. Because if you have a really small wide-to-wide diameter, you can, maybe it's a little bit more difficult to have continuous suction during the treatment. But 12 millimeters or more wide-to-wide to start with. And if you have some experience, you can go lower than that. These are the ideal candidates.
Yeah. Well, that's excellent. I really appreciate you taking the time to talk about it. It's a very exciting procedure, and it's real interesting to see its development and how it's been evolving over the last year or two. And I appreciate you taking the time to talk with us today about it.
Thanks for inviting me. It's an honor to be here.